Welcome to Final BDS Made Easy. In this video, we are going to discuss the 1 markers from the subject of Public Health Dentistry. Question is, what is blanket referral? The blanket referral program involves issuing referral cards to all children, which they take to their family dentists. Dentists sign these cards upon completing examinations or treatments. School nurses or teachers then follow up with children and parents to ensure that the process is completed. Second question is, what is calibration? Calibration in public health dentistry refers to the process of standardizing examiners to ensure consistent and reliable evaluation of oral health parameters. It involves training and assessing examiners to interpret findings consistently, reducing variability in data collection and ensuring accurate assessment of dental conditions. Third question is, what is composting? It is a process of nature where matter breaks down under bacterial action, resulting in the formation of a relatively stable, humus-like material called the compost, which has considerable manurial value for the soil. Fourth question is, what is standard deviation? It is defined as the square root of the arithmetic mean of the squared deviations of the individual values from their arithmetic mean. Here is the formula. Question 5 is, what are space maintainers? Space maintainers are dental appliances used to preserve the space left by prematurely lost primary teeth, ensuring proper alignment and eruption of succeeding permanent teeth. What are the barriers to health education? First is psychological barriers in communication stem from emotional disturbances or psychosomatic disorders. Second are the physiological barriers including difficulties in self-expression, hearing or vision. Third is environmental barriers like noise or poor visibility. And fourth is cultural barriers involving respecting beliefs and customs to ensure effective message delivery without causing offense. Seventh question is, what do you mean by validity of an index? The index must measure what it is intended to measure, and it should correspond with the clinical stages of the disease under study at each point. Question 8 is, what is an incubation period? The incubation period refers to the time between exposure to a disease-causing agent such as bacteria or viruses and the appearance of the first symptoms in an individual. It is a critical factor in understanding the transmission and control of dental diseases within populations. What is primary health care? Primary healthcare is defined as essential healthcare based on practical, scientifically sound, and socially acceptable methods and technology made universally accessible to individuals and families in the community through their full participation and at a cost that the community and the country can afford to maintain at every stage of their development in the spirit of self-determination. It is given by joint WHO and UNICEF International Conference at Alma Ata, USSR. Question is, what is ethics? There are two definitions, so you can learn whichever you want. First one is, ethics is defined as the science of the ideal human character and behavior in situations where distinction must be made between right and wrong. Duty must be followed and good interpersonal relations maintained. Ethics is also defined as the philosophy of human conduct, a way of stating and evaluating principles by which problems of behavior can be solved. What is bias? Bias is any systematic error in the determination of the association between exposure and disease. Next question is, what is epidemiological triad? It consists of the environment, agent and the host. What is Pathfinder survey? It is a stratified cluster sampling technique which aims to include the important population subgroups likely to have different disease levels and to cover a standard number of subjects in specific index age groups in any one location. What is epidemic? The occurrence in a community or region of cases of an illness or other health-related events clearly in excess of normal expectancy. Question is, what is cluster sampling? A sampling procedure often used when sampling units naturally form themselves into groups or clusters. A number of such clusters are randomly selected from a list of clusters, and all sampling units in each selected cluster are entered into the final sample. What is screening? Screening is defined as the use of presumptive methods to identify unrecognized health risk factors or asymptomatic disease in persons determined by prior studies to be potentially at elevated risk and able to benefit from interventions performed before overt symptoms develop. It was given by WHO in 1994. Number 17 is, what are dental auxiliaries? Dental auxiliary is a person who is given responsibility by a dentist so that she or he can help the dentist render dental care, but who is not himself or herself qualified with a dental degree. Non-operating auxiliaries are dental surgery assistant, dental secretary or receptionist, dental lab technician, and dental health educator. Operating auxiliaries are school dental nurse, dental therapist, dental hygienist, and expanded functions of operating dental auxiliaries. What is normal curve? When data is collected from a very large number of people and the frequency distribution is made with narrow class intervals, the resulting curve is smooth and symmetrical, and this is called a normal curve. Number 19 is, what is nursing bottle caries? It is a form of severe tooth decay in young children caused by prolonged exposure of teeth to sugary liquids from bottles, leading to rapid and extensive caries, especially in the upper front teeth. Question 20. What is odds ratio? It is a measure of the strength of the association between risk factor and the outcome. Question 21 is, what is defluoridation of drinking water? Defluoridation is defined as a downward adjustment of fluoride ion concentration in a public drinking water supply so that the level of fluoride is maintained at the normal physiological limit of 1 part per million to prevent dental caries with minimum possibility of causing dental fluorosis. It can also be defined as the process of removing excess naturally occurring fluoride from drinking water in order to reduce the prevalence and severity of dental fluorosis. What is vital layer? A slimy growth is formed on the surface of the sandbed after a few days of operation of the filter. This is known as Schwartz-Tecke vital layer, Zuclier layer, or biological layer. This layer consists of thread-like algae, plankton, diatoms, and bacteria. The vital layer is the heart of the slow sand filter. It removes organic matter, holds back bacteria, and oxidizes ammoniacal nitrogen into nitrates and thus helps in purifying the water. It extends for 2 to 3 centimeters into the top portion of the sandbed, and it may take several days for the vital layer to form fully, and until the vital layer is fully formed, the first few days filtrate is usually run to waste. The formation of vital layer is known as ripening of the filter. Question 23. What is the public health significance of 31st May and 1st December? 31st May is World No Tobacco Day, which highlights the health risks associated with tobacco use and advocates for effective policies to reduce tobacco consumption. 1st December is World AIDS Day, dedicated to raising awareness about the AIDS pandemic caused by the spread of HIV infection and mourning those who have died of the disease. Number 24 is, what is UCR fees? UCR stands for usual, customary and reasonable fees, which are the amounts typically charged by dentists for particular services within a specific geographic area used by insurance companies to determine reimbursement levels. Question 25 is what is Blooming Initiative? The Bloomberg Initiative was to reduce tobacco use and it was launched in 2006 by a US $125 million gift from Michael R. Bloomberg, a financier, philanthropist and mayor of the city of New York. Question 26 is what do you mean by Smiles to Go? It is a 65-foot articulated tractor-trailer which is used for providing dental care for school children and dental care at community sites. It includes a dental laboratory and is mainly associated with the New Haven inner city school system. Question 27. Write the full form of IA-PhD, UNDP, CARE and SHARP. IA-PhD stands for Indian Association of Public Health Dentistry. UNDP stands for United Nations Development Programme. CARE stands for Cooperative for Assistance and Relief Everywhere. And SHARP stands for School Health Additional Referral Program. Question 28 is what is blinding? The term blinding refers to keeping trial participants, investigators, and statisticians unaware of an assigned intervention so that they are not influenced by that knowledge. Blinding prevents bias at several stages of a trial. Question 29 is what do you mean by pandemic? It is an epidemic usually affecting a large proportion of the population occurring over a wide geographic area such as a nation, a continent, or the world. Question 30 is what is triclosan? It is a phenol derivative which has been included in mouth rinses and toothpastes. It is synthetic, non-ionic, and is used as a topical antimicrobial agent. Triclosan has a broad spectrum of activity against both gram-positive and gram-negative bacteria. Number 31 is co-insurance. It is also called as co-payment. It means that the patient pays a percentage of the total cost of treatment. Insurance carriers limit the range of healthcare services covered. This is termed limitation of benefits. Co-insurance helps keep premiums down. Coinsurance is defined as an arrangement under which a carrier and the beneficiary are each liable for a share of the cost of the dental services provided. Example, a patient has to pay 20% of the cost of hospital care, the remaining 80% will be paid by the insurance company. Question 32 is prevalence. It is defined as all current cases, both old and new, existing in a given population at a given point of time or over a period of time. Question 33 is third generation sealants. These are visible light polymerizing sealants where visible light activates photoinitiators that are present in the sealant material and are sensitive to visible light in the wavelength region of around 470 nanometers. The setting time is shorter, namely 10 to 20 seconds, and the working time is longer and the material does not set until exposure to the polymerizing light. Through the elimination of the mixing step, fewer air bubbles are incorporated with the sealant application. Question 34 is matching. Matching is defined as the process by which we select controls in such a way that they are similar to cases with regard to certain pertinent selected variables, example age, which are known to influence the outcome of the disease and which, if not adequately matched for comparability, could distort or confound the results. 35 is TLD of fluoride. The tolerable upper intake level of fluoride for adults is 10 milligrams per day. This is the maximum amount of fluoride that can be consumed daily without the risk of adverse health effects. Certainly lethal dose is 32 to 64 milligrams fluoride per kg body weight and safely tolerated dose is 8 to 16 milligrams fluoride per kilograms body weight. Known to unknown. Before the start of any health education program, the health educator should find out how much the people already know and then give them the new knowledge. The existing knowledge of the people can be used as the basic step upon which new knowledge can be placed. Example, a health education program with the aim of introducing a toothbrush to a rural population will be better appreciated if the communicator starts the program with what are you using to clean your teeth at present, and then going into details like why are you using it, and then connecting it to the toothbrush and then providing details about the toothbrush. Question 37 is global monitoring age. The global monitoring age for oral health as recommended by the WHO is 12 years. This age is chosen because it is the age group at which children typically have a full set of permanent teeth excluding third molars. Number 38 is the crude death rate. It is defined as the number of deaths per thousand people in a population in a given year. It is easy to calculate. The level of mortality is used as a public health indicator. The formula is number of deaths in a year in a population divided by the mid-year population into 1000. Number 39 is cohort. It is defined as a group of people who share a common characteristic or experience within a defined time period. Question number 40 is deductible. It is a stipulated flat sum that the patient must pay towards the cost of treatment before the benefits of the program go into effect. It is sometimes called front-end payment. Question 41 is sensitivity of index. The index should be able to detect reasonably small shifts in either direction in the group condition. Question 42 is give example for socio-economic status scale. An example of a socio-economic status scale is the Kuppuswamy's socio-economic status scale. This scale classifies individuals or families based on factors such as education, occupation, and income. Number 43 is web of causation. This term was coined by McMahon and Pugh. It is applicable in certain diseases, especially chronic diseases where the causative agent may be unknown or uncertain and the disease is the result of interaction of multiple factors. Removal of some of them or even one of them may be sufficient to control the disease. Thank you for watching. If you appreciate this video, do hit the like button, share it with your friends, and please subscribe to my YouTube channel. Stay tuned for more such videos.